Niko sawa.
Kiswahili sio?
Kiswahili.
Kwa kama.
Kiswahili.
Hano mabros. Karibu tena.
Nataka kusema hatujakosa kwa sababu tunakuja muda mmoja na mwenzangu na tumetoka sehemu moja.
Ulisema dawa tunaweza mpaka mwisho wetu.
Mombasa, the white and blue city in the sun, is rising. The city of merchants is now engulfed in numerous infrastructural projects from the roads to the port. But beneath these developments are deep and dark secrets. HIV/AIDS, drugs and substance abuse are prevalent among the strong and productive members of this society.
Currently, Kenya's HIV prevalence stands at 4.9%, according to the KenFIA data. But Mombasa County prevalence is at 7.4%, which means it is slightly above the national prevalence. This makes Mombasa County medium burden county that requires attention so that then efforts can be put in place to ensure that HIV prevalence in the county reduces.
Alfred Karani is lucky to live to tell his story.
Mimi ninaishi Jomvu, mtaa unaitwa Matofalini. Mimi mwenyewe mzee wa mtaa wa mtaa, na nilijua kwamba naishi na virusi, lakini sikuwa tayari kujikubali. Nilikuwa nikikataa kabisa, lakini kupitia kwa support group na kadri vile walivyonisaidia nikajikubali, nikaendelea kuishi vizuri mpaka sasa. Natumia dawa vizuri, ninapata masharti ya hospitali, good adherence.
He is among the many residents who have enrolled in a program called KADRI.
KADRI stands for Kenya Ports Authority AIDS and Drug Response Initiative. Its aim is to contribute to reduction of new HIV infections and also reduction of AIDS and substance abuse related deaths.
The project has 3 strategic objectives. The first strategic objective largely looks at prevention initiatives, basically to build knowledge and skills around prevention. And then the second objective looks at response initiatives, especially for those who are infected. How do they have access to care and treatment? And the third objective looks at social protection. Basically, how do you make life better for the people who are either infected or affected by HIV?
The project is funded by Toyo construction company with support from JICA, the government of Kenya, and Kenya Ports Authority.
In order to achieve the 90% ART coverage, which was changed to 95%, KADRI is strategically emphasizing on HIV counseling and testing for populations and locations that are likely to yield high rates of HIV positivity among the KPA population. We emphasize on first identification, then testing occurs, then we link, and for those whom we've linked, we make sure they are retained and suppressed.
As a peer linkage advocate, carries out home visits. The NACADA officer engages in a counseling session at the Miritini CDF Health Center.
Kwa sababu sasa tunaona vile nilikuwa niko, kwanza mimi nilikuwa niko mwingine mbaya kwa sababu mimi nilikuwa ile nilikuwa nakula kulikweli, lakini sasa hii nashukuru nilipoingia katika hizi miradi ya inaitwa support group. Ninaona ninaendelea vizuri.
Kwa hivyo dawa mjakosa hata siku moja.
Mimi naweza kusema hatujakosa kwa sababu tunakuja muda mmoja na mwenzangu na tumetoka sehemu moja.
Ulisema dawa tunaweza
mpaka mwisho wetu.
Hakuna pesa dawa ngana, hakuna siku ya mwisho ya kuacha dawa.
Na kuna siku mlimeza mkasikia tumechoka leo, wacha tusimeze.
Lakini sasa uchofu upo. Saa zingine za meza ukawa wasikia ni kama usijisikii kula. Zingine wajisikia ni kama kuna.
Ukisikia hivyo mnafanya
inabidi sasa tukae kwa sababu tunakuja tuambia tuje kama hospitali tupewe dawa.
Mkae. Mkisikia hivyo mnaacha kumeza dawa ama bado mnameza?
Tunameza.
Such sessions are also taking place in other facilities. This is the last one for the day. The program is clearly making inroads within the community.
We have been able to go to the community, reach our youth, women and men who are engaged in drugs, even older people who are using drugs. We have been able to talk to them, counsel them, to beg them to come for testing. Through that, we have tested many. We have identified HIV, new cases among the drug users, and we have been able to allow them into care and also to retain them through forming support groups whereby we meet at least once a month. We talk to them, we educate them on the importance of adhering to treatment and also to stop abusing these other drugs. KADRI has helped us to be able to go and do home visiting for those ones who are not able to reach to our facility. By doing so, we have reached so many, and many are adhering to treatment and their lives have changed.
The KADRI Project has helped us in terms of stigma reduction, because when we come together with the patients, they share their stories, and at least it helps in stigma reduction. It also has impacted us on viral suppression. Most of our patients who have been having high viral loads, currently after we have those meetings, they tend to be virally suppressed.
Through the outreaches, we've been able to link our clients. There's also the data reviews that we do hold that they support. It has helped us in decision making for our facility. And for the support of the peer linkage officer, it has helped us especially with issues of adherence.
When KADRI came, it changed. It helped the situation. We were able to get them. We were able to track them back to the facility. We were also able to empower them, and at least it has improved the setup as right now.
It has also supported in terms of ART initiation, and also at the moment you're going on with issues of having to ensure that we achieve the recommended 90% viral suppression among plants on ART.
We were able also to support about 55 people living with HIV with economic and livelihood training, and we were able to give some startup kits.
Tulikuwa na training, walipaka kufundisha jinsi kuendesha biashara ndogo ndogo. Tukaanza na biashara ndogo ndogo, wakatupatia pesa, nikaanza nayo biashara yangu kidogo kidogo. Sasa ndio najiendeleza nayo mpaka sasa.
Walinisaidia kunipatia tanki ya maji, ambapo sasa nikijaza maji nauza polepole. Hiyo ndio msaada ambao walinipatia.
Hiyo pesa yangu kidogo kidogo naweza kulipia watoto sisi na tunakula na tunaendelea na maisha.
My name is Salome Wasike, Senior Nursing Officer, Kenya Ports Authority. I'm also the program coordinator for the workplace programs. This is KPA Medical Department, headed by Dr. Gome, who is the head of medical services.
We have achieved all our performance contracting targets set for that part of the organization, and we are glad that the people are able to go to care when they get affected by either HIV and AIDS or struggling with issues of alcohol and drugs such as abuse at the workplace.
But there are challenges.
The major challenge that we're facing is just stigma, but it's declining.
In the CCC, we are faced with challenges of denial, especially to our newly tested HIV-positive patients. Some deny to accept that they are positive, whereby we are involved in extensive counseling for them to accept the status. We are also faced with a challenge of poor adherence to some of our plans, whereby we do close monitoring to ensure that they adhere well and they become virally suppressed.
The COVID season generally, which affected a lot of the economic activities and also the work we do, especially the community-based activities. And therefore we had to innovate around the COVID season, and part of the things we did is to just ensure that some activities that were not group-based, issues to do with like commodity distribution like condoms and IC materials were ongoing, and we innovated other ways of providing education just to be aligned with the government mitigation measures